have two beautiful nurses in studio. Hello, Nancy. Hello, Anita. How are you? So do I have to address you guys, like you ladies, like Nurse Anita, Nurse Nancy, or what?
No.
Which is which? I'm free to say your names.
Just call us by our names.
Oh, okay. So a little introduction, Anita.
Okay, so I'm Anita Ando, a nursing officer at Holy Child Catholic Hospital. Yeah. And okay, so you speak.
Nancy, please speak.
I'm Nancy Kofi Kwanzaa.
Are you the shy type?
No.
Oh, okay. No. I like that. Anyway, ladies, I brought you here for us to talk about breast cancer. You know, the whole month of October is actually Women's Month. And there is this issue with regards to most women that needs to be talked about. Our health is our priority. And this particular month, you're looking at breast cancer. Maybe later on I'll bring you back and then we talk about other forms of cancers that affect our women. How did it start? And how long has it been with us?
Okay, so thank you. Hello to your listeners. Breast cancer is the second most dangerous cancer in the world, and then unfortunately it affects women. Mostly, even though men are affected, but mostly women. And it is very important that we talk about it because it is taking a lot of lives. From research, it used to happen to women above 55 years.
Okay.
But it looks like we are recording cases of women, young women, being affected, maybe from 30, 35, thereabouts, also being infected. And it is very important that we create awareness about breast cancer. That is why we are here. And I think Nancy and I have been going around speaking about it. And it's not really about breast cancer alone. We also speak about cervical cancer, which I'm looking forward to an invitation that will
don't worry, that's what I said. I'll bring you back and then we'll talk about that one. That one, I'll put you on Pillow Talk. Yeah.
Yeah, so breast cancer is very, 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 very important.
It's very deadly, huh?
Yeah, coincidentally, today is no bra day.
Yes, the guys were insisting that I shouldn't put on a bra. But I don't think my breast is enough to go through that challenge.
Yeah. So, and I think it was created to create an awareness of breast cancer. And I think a lot of people are looking down to it. And sometimes I find it very sad that the health system is not concentrating much on breast cancer. It is very, very sad. I mean, looking at young women being sick with cancer, where their breast is taken away, where they die. And it is very, very sad. So, in fact, we are so happy. We are privileged.
Actually, you're scaring me now. Yeah. What are some of the symptoms, Nancy?
Okay. Some of the symptoms are, you see, first symptom will be pain.
Pain in the breast?
In the breast.
You're making me touch my breast. Can't you come and touch it?
Pain in the breast. And then you see redness on the breast.
Any part of the breast?
Any part of the breast.
Okay.
Then dimpling. When you touch your breast and then you remove your finger, there shouldn't be any form of dimpling in the breast.
Okay.
And then there's this kind of discharge. When you are not breastfeeding or when you are not pregnant, there shouldn't be, nothing should come out of your nipple. So when you are there and then you are seeing any form of fluid, either bloody or whitish or however it is, you have to report.
That would be extreme cases, right? But
no.
What are some of the early signs? Or these are all parts of the early signs?
Yeah,
breast cancer doesn't have an early sign.
Ooh.
So it will get to the second stage where you are not aware, and then you see some of these signs. That is why we encourage that at the end of every menstruation as a woman, you should do self-breast examination.
Okay.
Yes, to find, you check yourself, you examine your breast. I think a lot
How
of people
do we do
don't
that?
know.
Okay, we are live on Facebook, so you can actually, take them through the process.
So it's very sad a lot of people don't know their body system. So, you see, after every menstruation, it is very important, even not menstruation, as a normal woman, sometimes you have to stand in front of a mirror naked and then check your body and then see.
Raise your hands and then
there are changes in your whole body.
Okay.
So I'm talking about the whole body.
Okay.
So I had this nursing lecturer. She would tell us that as women, you should sometimes take a mirror, lie in bed, open your legs and then watch your vagina.
Okay.
At least, so you have to examine your whole body. So when there are changes, you could easily identify it.
You know that we live in a society where if a woman does those things, she's considered a sport.
No, at least in your room.
In your room.
So you stand in a full mirror, you examine your whole body. So if there are changes, you would easily identify it. So as she was saying, in the mirror, you raise up your whole hands. So both hands are up, and then you check your breast. So the whole breast, you check out the nipple and then the areola. The areola is the darkened part of the breast. So you check all these things if there are changes. So I know I'm fair. So if I see a wound or a dot or something, I should be worried.
Some kind of rashes there.
I should be worried.
He's not there. You should know.
Yes. You should be worried. So during the months, before we talk about that, she mentioned that a sign of breast cancer is a lump. We have different types of lump in the breast, which are not always cancerous.
Like fibroadenoma.
Exactly. So we have fibroid adenoma, we have the breast cyst, and then we have the fibrocyst.
So those are not cancerous. So if you see a lump in your breast, it doesn't mean anything.
You should.
Right.
That is why we are saying that.
It depends on the stage of your cycle.
Exactly. So visit the hospital for clinical examination as well. So the breast has a normal lump. So during your self-examination, you realize that there is another lump which is movable. It is movable and it is painless. You will touch it and then you will not feel any pain in that particular lump. Then you should be worried. And especially if it is after your menses. Okay. Because during the menstrual cycle, hormones plays a lot of role in the body. So because of the hormonal changes, these breast cysts and then fibroadenoma, fibrocyst comes into play. So they are not cancerous.
Okay.
But
they can easily be removed.
Yes. Apart from it being easily removed, it goes away on its own. So after your menses, after 3-4 days of your menses, it is very important that you examine yourself. I'll leave it to Nancy for her to show you how it's going to be.
Okay, Nancy, please go through it.
So with a self breast examination, with a self breast examination, you have to. Those of us with small boobs, you just have to stand in front of the mirror. You raise your arms to test for the consistency, how your breast will move. You move forward. So when the breast moves and one leaves behind, you see, if only one moves and the other is not moving, the one which is not moving, there is problem with it.
Oh, okay.
The two should move together. When I try to move my chest,
I should try and bounce my breast.
You throw your chest forward.
Yes.
Yeah.
So
they're bouncing and bouncing.
it will bounce.
Yeah.
So you have to bounce your chest and then you see how it will move. Then you check for the size. So with the size, most of the time we have that one breast is bigger than the other.
Naturally.
But it shouldn't be so obvious. If one is obviously bigger than the other, then you note it down. Then, after checking the physical anatomy of the breast, now you are coming to the examination. You put, if I'm going to examine my my left breast, I'll put my left arm at the back of my head.
Okay.
Then
so I'm going to try that.
Do it with me. Yeah.
Okay.
Then I will start from, as for me, usually I start from the axillary.
Okay.
Because another sign of breast cancer is that the axillary lymph node will be swollen. So it will look like a lump there. Okay. How do you call it? People get boil and then they think it's a boil, just boil like that. Yeah.
Normal boil.
Yeah, but this one with the axillary lymph node, you will see that just right from the breast to the armpits, there is a lymph node or there is a swelling there. You don't have to see it as a
normal boil.
You have to bring it to the hospital.
So if the boil moves to the breast area, it is not normal?
It's not normal.
Okay.
So when you are examining and then you feel pain there, please just come for us to do the examination for you.
Okay.
Yes. So you start the palpation from there, then you move it towards, you can either do it clockwise or anti-clockwise.
But it has to be circular motion.
Yeah, circular motion. So you move your fingers, your 3 index fingers. Yes. You move it through I am doing it clockwise.
Okay.
So I'll move it through.
We're all doing the test too.
Yeah, so whilst you are examining, if you note any form of lump moving, then you note it down.
Okay.
Then you continue.
All right.
So you
Can the
then-
husbands or boyfriends help us too?
Why not?
Yes.
Okay.
So
Because we can't do this alone.
So you move through to the middle part of the breast. So you start with the edges, then you move to the middle part of the breast. Whilst you are moving to the middle part, you'll be moving your fingers towards the nipple area.
Okay.
Then you go to the areola, the darkened part of the breast. You move there to palpate. Then you palpate towards the nipple,
Okay.
towards the inwardly, yes, towards the
To
nipple.
see if there's any pain.
Any pain, any discharge. When you move towards the nipple side, you move inwardly, outwardly. If there is any form of discharge, it will come.
Okay.
Then you press on the areola or your nipple.
Squeeze the nipple.
Squeeze
The
it
nipple.
to
Okay.
find out if there will be any form of discharge. You do the same thing to the right side. So whatever you note down, any form of changes you find out, you just have to come to the hospital for clinical breast examination.
Okay, what if I'm there and I'm like, okay, I just want to come to the hospital. I can't go through all the process and I don't have any guy around me to help me do that because they make it easy. Can I come to the hospital?
Why
Is
not?
it expensive?
No. It's actually free.
It's actually free.
I can walk into any
You can walk
hospital
into
and
any
go like, I want to have
hospital.
a breast, my breast
Examination.
I
examined.
don't know with other hospitals, but where we are,
Mm-hmm.
Holy Child Catholic Hospital, when you come to the maternity unit
Mm-hmm.
for breast examination, no one will charge you for anything.
Oh, okay.
Yes.
Okay.
And then, so I talked about the people with small breasts,
Mm-hmm.
those with huge boobs,
Mm-hmm.
heavy ones. When you are sitting down, you can't, or you are standing, you can't do the self breast examination
Mm-hmm.
because of the size of the breast. So you have to lie down.
Oh,
So
okay.
whilst you are lying down, it will be the same procedure. You put your when you are examining the left arm, the left breast, you put the left arm at the back of your head. Then you lie down so that the breast will relax, so that you can get to the root of the breast.
Oh, okay.
But while you are sitting down with the heavy boobs, you can't get to the bottom or the where whatever you want to do, you wouldn't find out.
Wow. So these are some of the things you're supposed to do to examine our breast.
Yeah.
Anissa, you want to add up?
I want to add up. You see, the lump is not the first thing to notice in breast cancer.
Okay.
This is where a lot of people get it wrong. That if there is no lump, there is no breast cancer.
I was about to ask that question.
Yes. So sometimes, as we said, other signs and symptoms will happen without a lump. So as she said, so you examine, and normally the affected breast, the arm at the affected breast it normally gets swollen or edematous. It becomes swollen. And then, as she mentioned, you have a painful breast. When you touch your breast, you can't, you won't be comfortable. And then there will be scaling and then peeling off at the areola. It is very, very important that you note that.
Okay.
And then we have this thing called Paul d'Orange. So you see when an orange is getting spoiled, see those dots, then
Around
playing
it.
around it.
Yeah.
This is how
the
the
breast
breast
will
will
look
look
like.
like.
So I come to the hospital and you guys detect that, okay, I have symptoms of breast cancer. What next?
So you'll be taken through diagnostic investigations such as breast scan, mammogram to confirm actually what is happening within,
Okay.
and then we take it from there. So when we realize that it is the lump in the breast is cancerous, then you might be taken through either chemo, lumpectomy, mastectomy, total mastectomy, where the breast will be taken away, or if it's lumpectomy, the lump in the breast will be removed. And then if you need chemo,
If they
then you
remove
go
those,
through-
will I still have my breast intact?
No. You see, that is why.
Only the lump.
Yes. When
Early
so when you
detection.
take the lump
Yeah,
out, yes,
yeah.
you
My
have
breast
your
will be intact.
Yes. So mastectomy is when the whole breast tissue
That's when it's gotten
to
Extreme.
the
yeah.
So I'll be without
final
breast.
stage. Yes.
Yes.
Like without breast.
Without
yes,
breast,
without
yes.
breast.
But
So
you can
don't
give
have-
you
you can prevent you can prevent this from happening
Okay.
by examining yourself every month.
and we can provide you with prosthesis.
Okay.
So
Shell
something to
breast.
wear like a
Oh,
breast.
come
But
on.
you don't want
It wouldn't be like the
exactly.
natural
We don't
one.
want you to get to that stage.
Okay.
And then you see, breast cancer doesn't have a cause. I know somebody will be asking, what is the cause? What is the cause of this? It doesn't really have a cause. But you see, there are certain things that we do that leads us to breast cancer.
What
Some
are
of
some
them
of those?
we have control over, some of them we don't have control
The ones we
over.
have control over, please let me know.
Okay, so like smoking, alcohol, smoking, alcohol intake, especially tobacco intake, has a way of finding itself in all cancer cases.
Yes.
So alcohol, excessive alcohol intake, smoking, radiation, hormonal imbalances. You don't have control over your hormones. And then unfortunately, if you have a family history of cancer, any of the cancer, then you are at risk of breast cancer. And then you can consider
The family history of a cancer, maybe my
great,
grand-aunt, great.
exactly.
Yes.
You are at risk.
At risk. And then obesity.
Yeah.
Obesity too predisposes us to any form of cancer.
Wow.
Early menarche. So
Early
you see,
menarche.
some of them you don't have control over.
Those people who
Early
menstruate very early.
Menopause
Late menopause.
has a way
Because some family, when you get to 60, 70 before you
have your
menses will
menopause,
stop.
yeah.
Yeah. Those people too.
Others to like 30 something, then it's
Early
gone.
menarche. Yeah.
Anyway, what advice would you give to young people out there listening to us as we celebrate No Bra Day?
Okay. My advice to them is that they should take this very serious. People were laughing at me when I posted on my Facebook and my WhatsApp stats this morning that they shouldn't wear a bra. It's very important because when you don't wear the bra, your attention will be on your breast. Because as ladies, when we are moving about and you're not wearing bra, you see your nipple will be scratching on
Yes,
your
that's
breast.
the thing.
When your nipple
It's the
scratches-
nipple, oh.
When the nipple scratches on your breast and you feel pain in it, please come to me. Come to
Oh.
Holy Child. Yes.
Really?
You shouldn't be feeling pain in your breast. When the breast is bouncing, you are walking about and then it's bouncing and you are feeling pain in it. That's when you will know that something is wrong with you. But when it's in the bra will hold it. So no movement.
Oh, okay.
So just today, don't wear the bra.
But you are in bra.
Examine yourself. You see, examine yourself. Because and today, if you're not wearing bra, nobody will punish you for
not
that.
wearing bra. So I can
Yes.
go to the office with my nipples
Ow.
sticking in my dress like that.
Oh, but
Look-
we have
these
things-
gentlemen in the
No,
studio.
listen.
Hey!
We have things we can use to cover
the
nipple.
nipple.
Me,
Okay.
I've covered my nipple. My breast is small, so I'm not wearing any bra.
Okay, I hear you. When I came to the office, the guys were examining whether I have a bra on.
So they were checking your back.
Yes.
So they should take it serious. We are serious about it. It really helps. Just one day.
Just one day.
Yeah.
So
Anita.
I think some of the prevention ways is also examining your breasts every other month. Every other month. It is very important. When you are 35 years and above and then you can afford a mammogram or a breast scan, do it often so that you
How
will know-
expensive is the mammogram?
Some charge 300 cedis.
Oh,
Some, yes.
Yeah, some 250,
250.
300.
Depends
yeah.
on where you
Oh,
would
okay.
want to take
But
it
the
from.
breast
No,
scan
but
is not.
I
but the
actually
breast scan is
thought-
not
It's not
expensive.
no, I thought like you were talking 1,000.
No.
Okay.
So at least when you're
So
35
Because
years
if
above-
you really want your health, sparing, let's say, 500 Ghana cedis.
in fact, health,
wouldn't do
good health
anything.
is expensive.
Yes.
Yeah.
Good health is
So
very
35
expensive.
years and above, you
So
have to do
you
a
have
lot.
to do it,
Yeah.
and then you avoid smoking. I mean, you check your hormones. So
How do I check my hormones?
you go for hormonal therapy? It's not. I don't know if it's done in Ghana, but in the European countries,
It's
is
done.
done.
Oh, Ghana is done.
Really?
Yeah, you
no, I
just
don't-
have to go to a good hospital,
hospital.
where they have good lab.
Mm-hmm.
They do.
I want to check my
hormonal.
hormones.
Yeah.
Wow.
So hormonal therapy.
So you just have to see the gynecologist.
Okay.
avoid radiation. I mean, eat healthy fruits, vegetables.
Have a balanced
Then-
meal.
Exactly.
All right.
And-
Final words, Anita.
My final words. As I said in the beginning, if I think about women, it's of much concern to me and Nancy. I think we've been running around talking about, as I said in the beginning, we have been doing a lot of things about women. And I don't know, but let's take good care of ourselves as women. I mean, let's prioritize our health. It is very, very important. You see, as we are saying today is No Bra Day. Just imagine you are braless, you are boobless. Just imagine you have gone through a mastectomy because of breast cancer and then you don't have boobs.
Something you could have prevented.
Exactly. How will you feel about? You see, we have friends who are unfortunate and then they have this flat chest, who are women, and sometimes they speak to you and then they wish they had bigger boobs. Exactly. So
a lot of them lack confidence.
Exactly.
I know.
So put yourself in that stage that your breast is taking off and then you are boobless,
And it affects their sexual life too.
Exactly. I mean, even with the boobs, how many men call you? Or I mean, a lot of women go through some of these things. They have to go and do implants and all that. And imagine if you don't have a boob. So please, let's do everything possible to, save ourselves from breast cancer.
All right. Thank you very much, ladies. I really, really appreciate the conversation. And please stop attributing it to witchcraft. I need to say it.
Very
Stop
important.
attributing it to witchcraft. When you see the lump, stop saying that it is the witch in your family who has planted the lump over
I'm sorry.
there.
Okay.
Yes.
The last complication in breast cancer, we didn't mention it here, is death.
Yeah.
Oh.
You'll be fortunate if they remove your breast.
True.
You are fortunate. Once you have life, you have hope. So please, it's real. I have seen women dying out of breast cancer. I have seen women gotten to the terminal stages in
And
breast
it's
cancer.
expensive.
And it's so
the chemo alone is expensive.
Health insurance doesn't cover. You're going to die and you'll be going through all that.
Okay. So I beg you. What we are saying is get your breast screened. It wouldn't be bad for you to do it every month.
It's for free.
Every month. Get your breast screened. If you're a young lady, if you are 18 and above, right?
Yeah.
Yeah, 18 and above. If you see any of the
Since your
symptoms.
menstruation. You know, menstruating. You know, right now, a lot of people from 14
Yes.
even get their menses.
Yeah,
So
yeah,
it's very
yeah,
important that
Pay attention to your boobs, okay? When the guys are touching it and they tell you there's something somewhere, please don't insult them. Pay attention to the thing that they tell you and then go see a doctor or a gynecologist. Thank you very much, Anita and then Nancy. Anything you want to add?
Please, if you want your breast to be examined, you can walk into Holy Child Catholic Hospital.
Okay.
We have gynecologists
Over there.
We do our gynae clinic Mondays and Wednesdays.
Okay.
So if
today?
If anyone has any kind of problem, any woman has any form of problem, just walk into Holy Child Catholic Hospital.
All right.
Yeah.
Thank you very much, ladies. Have a beautiful day.
you to